The FDA advisory committee that recommended the vaccine largely agreed it is safe and effective.
But one of the no votes came from a University of Michigan professor who was concerned about the vaccine's long-term impact. Paula Tutman has more.
21 experts from various scientific fields sat on that Pfizer vaccine advisory board yesterday to the FDA. 17 voted yes, 4 voted no. University of Michigan virologist and viral pathogen researcher Dr. Ovetta Fuller voted no.
What does that mean for long-term effects that cannot even be looked at right now because we just got this into people?
But Dr. Fuller wants people to understand why she voted no.
Because the public needs to understand so they can do what they need to do.
It's not a lack of confidence in the research. It's that she believes some specific questions about risks through her goggles as a virologist did not get answered.
It would be better to have more data, broader data, to be certain that at least what we can look at, we've done our due diligence. I am also concerned, if I may just say, that with the vaccine, in boosting immune response to the S protein, which is the attachment protein of the virus, that we are now setting up a highly specific immune response for a virus that's going to be continually circulating.
The plain English version is, as a researcher and an expert in how viruses behave, she still had questions on the table in terms of autoimmunity and hyperimmunity. To break it down even further, she just wanted a bit more research before creating a full path to wide vaccinations to the masses.
I am a great advocate of vaccines. I think vaccines are a major way that we can stop or prevent infections, and that saying that a stitch in time saves 9. So I think it's incumbent upon us to do our due diligence and to release this gradually, as opposed to going from a complete clinical study to now an emergency use that offers it to millions of people.
She believes just 2 more months of controlled studies would answer some of those specific questions. She is aware that her voice carries weight and will as an expert to many who may not trust the science, the scientists, the process, or the vaccine. Her intent, however, is not to discourage, but to better investigate.
I think that was your long way of saying you're not going to be first in line to take the vaccine right now.
I would like to be,
but
I want some answers before that.
It's really worth your while to go to clickondetroit.com, where we have put the entire conversation with Dr. Fuller, because what she's saying can really help you understand the process and make your own personal decision about the vaccine. Paula Tutman, Local 4.